Hello everyone. In this video we are going to talk about the arteries of the head and neck, and in the next video I'm going to talk about the veins of the head and neck. We will discuss carotid artery and the subclavian artery, common carotid artery, carotid sinus, carotid body, and external carotid artery, and the internal carotid artery will be discussed in this video. The right common carotid artery arises from the brachiocephalic artery, whereas the left carotid artery arises from the arch of the aorta, and it's same for the subclavian artery as well, which we are going to discuss later. The common carotid artery divides at the upper border of thyroid cartilage into external and internal carotid arteries. So it's important to remember that in the carotid sheath, the artery is located laterally to the vein, and the vagus nerve lie between the two structures. So it's the internal jugular vein, then the vagus nerve, and then we have the carotid artery. Now we are going to talk about the external carotid artery. The mnemonic to remember the branches is some angry lady figured out PMS. S is for superior thyroid, A is for ascending pharyngeal artery, L is lingual artery, F is facial, O is occipital, P is posterior auricular, M is maxillary, and S is for superficial temporal artery. So mnemonic is some angry lady figured out PMS. I'm going to briefly discuss the arteries, the branches of the external carotid artery, which are important for the MCQ. So the first is superior thyroid artery, which is related to the external laryngeal nerve, and this nerve supplies the cricothyroid muscle. Then we have ascending pharyngeal artery and the lingual artery. The lingual artery is basically crossed superficially by the hypoglossal nerve. So it's important for you to remember the relations of the nerves with these arteries. Now the facial artery bends around the lower border of the mandible and ascends over the face close to the anterior border of the masseter muscle, whereas occipital artery supplies the back of the scalp. Posterior auricular artery supplies the auricle and the scalp. Superficial temporal artery is palpated just in front of the auricle and is accompanied by the auriculotemporal nerve. So it's important for you to remember where the superficial temporal artery is palpated. Then we have maxillary artery. Maxillary artery leaves the infratemporal fossa through pterygomaxillary fissure, and that enters into the pterygopalatine fossa. And there it splits into the branches of the maxillary. And it is followed by the branches of the maxillary division of the trigeminal nerve. So trigeminal nerve is related to the maxillary artery, the maxillary division of the trigeminal nerve basically. The middle meningeal artery is a branch of maxillary artery, and this artery enters the skull to the foramen spinosum, which is discussed in the another video, and it's also divided into interior and posterior branch. The interior branch is more important because it lies close to the motor area of the cerebral cortex, and this is also accompanied by its vein, and it's also prone to damage after the blow to the lateral side of the head, and this is going to lead to the extradural hemorrhage. Now we are going to talk about the internal carotid artery. The internal carotid artery terminates by dividing into interior and middle cerebral artery. It gives no branches in the neck, whereas it gives important branches in the skull. The branches are ophthalmic artery, posterior communicating artery, anterior cerebellar artery, and the interior cerebral artery and middle cerebral artery. Ophthalmic artery arises from the internal carotid artery, and it passes forward into the orbital cavity through the optic canal, and it then gives off the central artery of the retina, which is basically an end artery and the only blood supply to the retina. Anterior cerebral artery supply the medial and the superior lateral surface, whereas the middle cerebral artery is the largest terminal branch of the internal carotid artery, and it supplies all the motor area of the cerebral cortex except the leg area. It also gives off central branches that supply the masses of gray matter and the internal capsule. Shows the distribution of the middle cerebral artery in the medial and the lateral brain. I'm going to talk about the circle of Willis. It is present in the subarachnoid space in the base of the skull, and it's the anastomosis between the branches of the two internal carotid artery and the two vertebral arteries. Involved in circle of Willis include the interior communicating artery, the posterior communicating artery, the interior cerebral artery, and the posterior cerebral artery, and also the internal carotid artery. The cortical and central branches arise from this circle and they supply the brain. We will talk about the subclavian artery, right subclavian artery, left subclavian artery, and the parts of the subclavian artery. The right subclavian artery arises from the brachiocephalic artery, and the left subclavian artery arises from the arch of the aorta, as we have already discussed. At the outer border of the first rib, it becomes the axillary artery. The right subclavian artery becomes the axillary artery at the outer border of the first rib. The scalenus interior muscle is used to divide the subclavian artery into three parts. To remember the branches of the first and the second part of the subclavian artery is the vitamin C and T. V is for vertebral artery, I is for internal thoracic artery, T is for thoracocervical trunk, C is for costocervical trunk, and D is for dorsal scapular artery. The vertebral arteries send in the neck through the foramina in the transverse process of the upper six cervical vertebrae, and then they send to the foramen magnum into the skull. And on reaching the interior surface of the medulla at the level of the lower bone of the pons, it joins the vessel of the opposite side and they form the basilar artery. The basilar artery gives off branches to the pons, cerebellum, and the internal ear, and it finally divides into two posterior cerebral arteries. The two cerebral arteries, they give branches in the neck and also branches in the skull. There are spinal and muscular arteries branches in the neck, and the branches in the skull are meningeal, anterior and posterior spinal, posterior inferior cerebellar, and the medullary artery. The posterior inferior cerebellar is a branch of the posterior cerebral artery, so this is important for you to remember. Thyrocervical trunk give off three terminal branches: the inferior thyroid artery, the superficial cervical artery, and the suprascapular artery. It's important for you to remember for the MCQ, the recurrent laryngeal nerve accompany the inferior thyroid artery. The superficial cervical artery runs laterally over the phrenic nerve and crosses the brachial plexus, where the suprascapular artery runs laterally over the phrenic nerve and also crosses the brachial plexus. And it follows the suprascapular nerve into the fossa of the scapula, and it takes part in the anastomosis around the scapula. This is also important for the MCQ. The internal thoracic artery enters the thorax behind the cartilage and in front of the pleura. Then it divides into superior epigastric and the muscophrenic artery. The second part of the subclavian artery lies behind the scalenus anterior muscle, and it's give off two branches: the costocervical trunk and D is for dorsal scapular artery. The costocervical trunk divides into superior intercostal artery that supply the first and second intercostal spaces, and deep cervical artery that supply the deep muscle of the neck. The third part of artery usually do not have any branches, but occasionally they can give the two branches: superficial cervical artery or the suprascapular arteries. With the nerves of the brachial plexus, the third part of the subclavian artery is surrounded by the axillary sheath of fascia. So this was all about the arteries of the head and the neck. In the next video, we are going to talk about the veins of the head and neck, that is divided into veins of the brain, venous sinuses, diploic veins, emissary vein, and the veins of the scalp, face, and neck. So see you in the next video. Thank you for listening.